The arm is made up of three bones, the humerus, radius, and ulna. The humerus originates at the scapula and continues down to articulate with the radius and ulna. This video will focus on the humerus. The humerus is the second largest bone in the body and the largest bone in the arm. Many of the powerful muscles that help move the shoulder and the forearm at the elbow are attached to the humerus. The humerus is essential to a variety of movements of the arm, including throwing, lifting, pulling, and riding. Located at the proximal end of the humerus is a smooth spherical structure, the head. The head projects medially and superiorly from the shaft to form the ball of the ball and socket shoulder joint, also known as the glenohumeral joint. The glenoid cavity of the scapula is the socket where the head of the humerus articulates. The roundness of the head allows the humerus to move in a circumduction and rotate around its axis. The anatomical neck is located inferior to the head of the humerus. The articular capsule attaches to the anatomical neck, which also separates the head from the tubercles of the humerus. Inferior to the anatomical neck are two small processes, the greater and lesser tubercles. These tubercles are attachment points for muscles of the rotator cuff. The intertubercular sulcus lies between the greater and lesser tubercles. The intertubercular sulcus separates the two tubercles, allowing the tendon of the long head of biceps brachii to pass through this groove. The floor of the sulcus is also an insertion point for the latissimus dorsi muscle. Inferior to the two tubercles, the humerus narrows to forming the surgical neck. The surgical neck is the most common location for a fracture of the humerus. A fracture of the surgical neck will most likely cause damage to the axillary nerve and the posterior circumflex humeral artery. The most common way to fracture the surgical neck is by falling and extending the arms in order to stop the fall. About a third of the way down from the surgical neck and along the shaft of the humerus is a roughened area called the deltoid tuberosity. The deltoid tuberosity is an insertion point of the deltoid muscle. The radial groove is a shallow groove which wraps around the shaft of the humerus, located next to the deltoid tuberosity. The radial nerve and the deep brachial artery lie within the radial groove. Inferior to the deltoid tuberosity, on the anterior side of the humerus slowly begins to widen, almost doubling its width as it nears the elbow. The distal end of the humerus has two large processes, the capitulum and the trochlea. The trochlea is on the medial side of the arm and it interlocks with the ulna to form the elbow joint. The capitulum is on the opposite side of the trochlea. The capitulum connects loosely with the concave head of the radius. The shape of the elbow joint allows the forearm to rotate and bend at the elbow, while also allowing the ulna to form a tight hinge with the trochlea. On the posterior side of the humerus, in between the capitulum and trochlea, is a small cavity called the olecranon fossa. The olecranon fossa allows the head of the ulna, also known as the olecranon, to articulate to the humerus in order to prevent the elbow from extending beyond 180 degrees. On the anterior side of the humerus are two more small cavities known as the radial and coronoid fossae. The radial fossa is located superiorly to the capitulum on the lateral side of the coronoid fossa. During extreme flexion of the elbow, the radial fossa is where the margin of the radius head articulates. The coronoid fossa is located superior to the trochlea and medial to the radial fossa. The coronoid process of the ulna articulates with the coronoid fossa during flexion. Superior to the lateral and medial epicondyles, along the shaft of the humerus are two ridges, the lateral supracondylar ridge and medial supracondylar ridge. The supracondylar ridges run into the epicondyles to form the distal end of the humerus. Two epicondyles, medial and lateral, are located on the anterior side of the humerus. The medial epicondyle is located lateral and superior to the trochlea. The medial epicondyle attaches multiple muscles including the pronator teres and the flexor carpi radialis. Hitting the ulnar nerve against the medial epicondyle causes a painful tingling feeling of the arm, also known as hitting the funny bone. The lateral epicondyle is located lateral and superior to the olecranon fossa. The function of the lateral epicondyle is for attachment of the radial collateral ligament of the elbow and the tendon of the supinator and some extensor muscles of the forearm. When the tendons of the forearm become overused, the forearm can develop a painful condition known as lateral epicondylosis, or tennis elbow. In the fetus, the humerus is actually three bones, the diaphysis and the two epiphysis. Between the three bones is a layer of hyaline cartilage, the epiphyseal plate. Throughout childhood and adolescence, the cartilage continues to grow to form the humerus. By the end of puberty, the cartilage has stopped growing and been completely replaced by bone, forming the single bone found in an adult. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.